Today we're going to be talking about the menopause. What is menopause? What symptoms are you to expect if you're going through the menopause? And what treatment options you have available to you? Hi, I'm Dr. Nabil, an NHS GP based in Manchester, and I'm on a mission to make evidence-based medicine available for all. The menopause is a normal part of life for a female. During menopause, the balance of the hormones in the body changes, which can bring on a whole host of symptoms affecting both the body and the mind. And the symptoms may differ from woman to woman. It doesn't just affect your female reproductive organs, but also can affect the whole body, from your energy levels, your mood, the way you feel, your temperature gauge, and even things like bones and muscles and even your other organs too. So why is it important for you to know the symptoms? Well, firstly, if you're aware of the symptoms, then you know exactly what to expect when you're going through the menopause. Secondly, by knowing what the symptoms are, you can do a few things. Firstly, you can take matters into your own hands. If you know what symptom to expect and you're experiencing it, you'll have an idea of things that you can do to combat this. Also, it gives you a level of awareness of what could be happening in your life. So for instance, we have women presenting in the clinic when they mention things like brain fog, forgetfulness, not being able to perform at work or look after the family the same way they would before, and they were very confused as to what's caused this. They wonder if they had things like dementia, something perhaps like an infection in the brain or even within the body. And this can leave women very confused, not knowing where to turn to, and it can ultimately have a big impact not only on their own well-being and their mental state, but also things like impact on their family setup, their employment, and also their overall general well-being. So being aware of the symptoms that you might experience in menopause will allow you to understand what you can do next. Also allow you to seek out communities around you where you can have women with shared experiences that will allow you to further understand what you're going through, but also share them with someone in the exact same position as you. What do women experience when they're going through the menopause? So firstly, what one woman experiences is not necessarily the same as the next person. Often what you'll find that what someone experiences within their family, they may also experience. And what I mean by this is, if your mother's gone through menopause and you're aware of this, you may share similar symptoms. Similarly, you may also come onto the menopause at a similar age as your mother. There's something for you to be aware of. The symptoms themselves can vary into different categories. So we'll start off with reproductive health. You'll first notice that your menstrual cycle is changing. Usually you get a decrease in the number of periods and they can be lighter. You can have them flip the other way too. You also get a general dryness in the area, and you can have a reduction in your sex drive as well, which can have impacts on your well-being and your relationships. Moving on from this, you can have changes to your bladder. You might find that it's harder for you to hold onto your urine, or you're going more often, or you don't have the same control around your urine. Other impacts that you can have can affect the mind. So we talked about things like having brain fog, not being able to concentrate, seeing a reduction in your performance, also having an impact on your mood. So anxiety is a big one. Going through the menopause can trigger anxiety, but also make things like depression worse too. Menopause also affects the body. It can affect your general energy levels. It can affect your temperature gauge, so you can get hot flushes, feeling really hot and sweaty all of a sudden, usually typically at night. It can affect your metabolism, so you find that you can get weight changes in your body that you weren't used to before. You can also get impacts on other parts of your body, so you can get aches and pains in your muscles and your joints. So in the metabolism as well, you can find that you're putting on more fat and your body's more predisposed to create fat tissue. Menopause can also have an impact on your skin, so you may see skin changes that you've never had before that all of a sudden start becoming apparent. Another symptom that women experience is disruption to their sleep. Going through the menopause, you can often have poor quality sleep, wake up multiple times in the night, or actually the hot flushes impact your sleep directly too. So what treatments are available in menopause? The treatment really depends on what symptoms that you're experiencing in the menopause, and it will be tailored around addressing those specific symptoms. But the main treatment of choice is HRT, hormone replacement therapy. So what is hormone replacement therapy? So as you remember before, we talked about menopause leads to a reduction in the female hormones in the body. What HRT does is aims to top them back up to similar levels that your body experienced before. So where your body was deficient in the hormones and you're experiencing the symptoms, HRT should aim to eradicate most of that. Now what you might find is that you might not have a total elimination of your symptoms, which will allow you to manage better and regain that quality of life back. HRT can come in different forms. You can have progesterone only or progesterone with estrogen, and the way we administer this to the body can vary in different forms. So I'll break some of these down for you. One form can be a patch form, patch that you wear over a certain amount of time. It could be daily, it could be every few days. Another form is a gel that you rub on your thigh, and that's on a regular basis. You can have HRT in a pill form. It can be with one hormone or both hormones. You usually take this on a daily basis. You can also get combined type of treatment where you can get a coil inserted for the progesterone component and have a tablet or patch or gel on top too. These are usually the main forms of HRT treatment. It's best to have a discussion with your clinician so they can firstly work out what's appropriate for you and the best form of administration for you too that's manageable. So how long would you expect to stay on HRT? Now this varies from woman to woman. Some patients may experience symptoms for an extended period of time. It could be many years. However, for some patients it's only for a few years, so therefore the treatment time varies already from these two groups. The treatment duration also depends on how you're experiencing the symptoms. So you may find that as time goes on, you're able to have a reduction in your symptoms and you'll have better control over your symptoms, and therefore you don't need treatment as long. The most important thing is that you review your symptoms and your treatment with your clinician at every few year intervals so you can understand the benefits that you have and also if there's any risks involved too. Is HRT safe? So this is a great question. I know lots of women worry about the risk of HRT, or they may have come across some things in the media, social media, about the potential risk of HRT. When you have a discussion with a clinician, what we do is firstly risk stratify you. And what this means is we work out certain things by asking you questions that would lead to any potential risks. So things like previous cancers, a family history of blood clots, if you have any heart conditions, and this will help determine what is the appropriate HRT for you. So what this could mean is that if you, for instance, have a risk factor, you may be offered just a progesterone component as opposed to estrogen and the progesterone, as often it's the estrogen that can increase your risk of certain aspects regarding your health. The most important thing is the clinician will go through your risks with you, what your risks are, and how likely they are to occur if you were to go on HRT. What a lot of women have reported is that the benefit that they've gained from HRT far outweighs any of the risks that they could have been exposed to, and their quality of life, their well-being mentally and physically is so much greater being on HRT that they wouldn't even look back at not being on HRT. In fact, women are advocates for HRT and often will want to share their experiences in groups, and we have some local groups here near us in Hyde that do a fantastic job of doing that too. HRT isn't the only treatment option available for menopause. There are other options available too, depending on your symptoms. So for instance, if you suffer mostly from hot flushes and that's the main symptom that's causing distress, lack of sleep and frustration, then you may be offered another medication like, for instance, sertraline. Now sertraline is traditionally used as an antidepressant. However, we found that women who have hot flushes and menopause, when given sertraline, the number of hot flushes or the intensity of hot flushes decreases significantly. And this could be beneficial because it allows you to focus and treat on just the main symptoms that you're experiencing. There are other forms of treatment also available in menopause that depend on your symptoms. So I would encourage you to have a chat with your clinician, understand what's best for you and how to manage your specific symptoms. So what should you do if you think you're approaching or going through the menopause? There are menopause charities online that have great questionnaires that allow you to fill them in to understand your chance of having menopause. I would encourage you to do this if you have a variety of symptoms or even symptoms that feel confusing and not so obvious to you, and you might want to see if it could be menopause. The other thing you should do is reach out to your clinician. Often women going through changes of the menopause, particularly if they're under 50, can often feel like it's due to a deficiency or other changes within the body. So for instance, it can be mistaken for things like a thyroid problem, anemia, deficiency in vitamins. So what you might find is that after the clinician has a chat with you, if you have an awareness that you could be menopause through this questionnaire, you may be asked to do a blood test, and they will be looking for potential deficiencies and other causes of your symptoms. If you're under the age of 45, they may also offer you a female hormone check, as menopause is more likely to occur after the age of 45. After the age of 45, you usually don't need a blood test to prove this. Going off your menstrual history and your other symptoms usually is enough to give us an idea whether you're going through the menopause or not. If you were to have blood tests, you're likely to have a review once they're back. If there's no obvious abnormalities from your blood test, you will then have a conversation with your clinician about what menopause is for you, what your treatment options look like, and often we would encourage giving you information so you can read up on this and make an informed choice as to what's best for you. And remember, you can trial different forms of treatment. If one doesn't particularly work for you, I would encourage you to reach back out to the clinician, let them know that actually it's not helping with your symptoms, and if there's either different doses or different modes of treatment that might serve you better. Remember, menopause is a normal part of life. However, treatment will allow you to get the empowerment back, so ensure that you feel empowered to ask the questions to get the right treatment for you. If you feel like this video is beneficial for you or may even benefit other women, please do share with them. I would really appreciate if you like and subscribe to our channel, and also if you want to find out more about other health topics, why not check out our channel. Thank you for watching.